I think liposuction really is a tool to target areas of genetic disproportion. I really try to drive that point home. You know, as far as I'm concerned, it has very little, if anything, to do with being overweight and out of shape. You know, they're two completely separate things. You know, my role as a liposuction surgeon is to balance the body out, to target areas of genetic disproportion, areas that people have always struggled with. When they try to lose weight, they're the last areas to ever come off, the first areas to gain weight. And the reason is they have too much fat tissue there. They're just literally genetically disproportionate. My role in the consultation is to identify those areas. First of all, I do the evaluation completely myself. I think that one of these trends that's going on is for other people than the surgeon to evaluate the patient for liposuction. That's a huge mistake right there. But I evaluate every patient from their neck down to their ankles, and I make a determination where they're in or out of balance. I really don't want to necessarily hear where they want to do it. I don't want that to skew my evaluation. I think the patient is coming to see me as a specialist to get my opinions about what should be done. I'm going to be very complete about what to target. So again, it has very little to do with being overweight and out of shape. Sometimes I'll see a patient who is 108 pounds who can be a fantastic candidate for liposuction. For example, she might have very thin shoulders and upper body and have fullness in her upper outer thigh area, the saddlebag area. She's always struggled with it. Her mom has it, her sisters have it. Can be a great candidate for liposuction. She's doing virtually everything she can do. It's all up to me at that point. On the other hand, I might see a patient who's 200 pounds and they're perfectly in proportion, they're just overweight and out of shape. And actually, they're not a candidate for liposuction. And truly, it's a mistake to do those patients with liposuction, because then if the surgeon does that, and unfortunately that goes on many times, they will permanently throw them out of balance and proportion. So again, it's about targeting areas of genetic disproportion with liposuction.